DualCap is a unique addition to the IV line bundle, a disinfection cap system designed for use on needle-free valves and at the end of IV tubing, also known as the male luer connector. DualCap was invented by two infusion nurses who sought an easy, effective way to disinfect and protect IV catheter access points. Prior to DualCap, there was no safe way to disinfect and protect male luer connectors, a previously overlooked source of microbial contamination. Sterile, dead-end caps do not disinfect the male luer connector, and swabbing is not possible due to the risk of introducing isopropyl alcohol, or IPA, into the IV fluid pathway. The DualCap system consists of two caps. Each cap contains a sponge saturated with 70% IPA that disinfects all critical surfaces of IV access points. The light blue cap is designed for use on needle-free valves. The dark blue cap is designed for use on male luer connectors. Once attached, DualCap remains on the line to provide disinfection and protection until removed. To access DualCap in the IV pull strip configuration, using one hand, gently peel the cap off of the strip to remove. Avoid twisting the cap to remove. DualCap Solo products are sealed with a foil lid. Gently peel off the lid and discard prior to attaching to the needle-free valve. After removing DualCap from the packaging, twist the light blue DualCap onto the needle-free valve in a clockwise direction until the fit is secure. Twist the dark blue DualCap onto the male luer connector in a clockwise direction until the fit is secure. DualCap is single-use only. When line access is required, twist DualCap in a counterclockwise direction to remove and discard. Use two hands when removing DualCap to ensure the needle-free valve does not unthread from the catheter hub. DualCap should be attached to all needle-free valves on the following vascular access devices: central venous catheters, PICCs, PVCs, and Y sites on infusion sets. Follow your institution's protocol to determine what vascular access devices need to be capped. It is important to cap all needle-free valves on designated devices, not just the needle-free valve in use. Remember, DualCap is single-use only, so after cap is removed, it should be discarded. Never attach a DualCap to an open catheter hub. Only attach to needle-free valves. DualCap eliminates the need to scrub the hub when first gaining access to the line, but if sequential accesses are performed, it is generally recommended to swab in between accesses. Follow your institution's protocol. Should you have further questions concerning use of DualCap at your facility, refer to the instructions for use.